So before we start, any questions from last period, anything before what we've talked about? Just make sure I catch anything as you guys have been studying. Got it all down? You're going to ace the tests, be fine on all the quizzes? Okay, good. So then let's continue on with the back. So last time we talked about the vertebral column, the bones and the joints in there and how it all fit together. And now let's add some of the layers on top of that. So first part of what we're talking about is the ligaments. And two of the main ligaments of the vertebral column are the posterior longitudinal ligament and the anterior longitudinal ligaments. And they're pretty self-explanatory as far as their names go. So the anterior longitudinal ligament runs along the antitudinal surface of the vertebral bodies from the sacrum to the, make sure I get this right, base of the skull, all the way up. And along the way, it attaches to the vertebral bodies and the intervertebral discs all along its length. So it just helps to stabilize the entire vertebral column. The posterior longitudinal ligament is the same picture, just on the posterior surface of the vertebral bodies, and extends from C2. So it doesn't go all the way up to the skull, but it extends from C2 down to the sacrum. And also attaches to the vertebral bodies and the intervertebral discs along its way. So those are two main ones there. In between the ligaments, we have the ligamenta flava, or singular is ligamentum flavum. And this is a series of segmental ligaments that go from the posterior superior aspect of the inferior articulating process in the lamina to up onto the anterior aspect of the superior articulating surface. Yes?
Can you say that one more time?
Yes. Yeah. That was a big mouthful, wasn't it? Yeah. So it goes from the, let's make sure I get this right. Yeah, so the posterior surface of the lamina, so lamina, on the inferior part of the pars interarticulata, and then to the anterior lamina of the inferior part of the pars articulata of the next vertebra. Did I say it backwards? Yes, I did. You know how to do that. Too many superiors and inferiors. So superior aspect, and this is on the inferior aspect. Okay? And you can see here in a posterior view that connecting here to the lamina and then tucking in up inside the next vertebra there. So connecting those two together, and it limits the amount of movement the vertebrae can do within flexion. So it prevents gapping here between the vertebral arches.
Wait, doesn't it go from posterior inferior to anterior?
So posterior, superior of the inferior vertebra. Yeah, so posterior part of the lamina, posterior superior part of the lamina, and then anterior, so this side of it, kind of tucked in underneath of the inferior part of that next lamina. Does that make sense? There's a lot of words there, I can understand. Okay, so that's the ligamenta flava. Then along the tips of the spinous processes, all the way up, we have the supraspinous ligament, and it goes all the way from the end of the sacrum all the way up to technically the spinous process of the C7 vertebra. Now it does continue, but it changes name at that point into the ligamentum nuchae. And at that point, instead of just being a thin line along the entire spinal column, the spinous processes, it widens out into this roughly triangular shaped structure here that goes along the spinous processes of the cervical vertebrae up the external occipital protuberance, so just a ridge right along the back midline of the skull, and fills in that whole area. And that broader area is really important for muscle attachment. I can spell. There we go. Muscle attachment for the cervical muscles. Okay, a lot of the neck muscles. Right, so that is the supraspinous ligament. So here's another way you can see it. Here's the supraspinous ligament right here, the ligamentum flavum kind of right here, and there's one on each side there. And then filling in is the interspinous ligament, so that fills in all this area in between. And they all kind of merge together, so it's almost like a continuous sheet of ligamentous material, just slight differentiations between them and that can be seen histologically, and slight functional differences. So this again would be preventing gapping between the spinous processes and also too much rotation between the spinous processes. So in general, we can say ligaments are just kind of trying to reduce the amount of movement available to make sure there's less stress on the bony structures. Yes?
Did you say the interspinous ligament connects the spinous processes?
Mm-hmm. Yeah, it connects on all sides of the spinous processes all the way around. And so it interconnects them all. Okay. So that's ligaments. Know them, that's about all I can say, because they're important. A lot of them, in addition to interconnecting bones, are going to be, like I said, for the ligamentum nuchae, going to be very important for muscle attachment points as well. Okay, so then let's move on to the muscle structure. And so we'll start with the superficial group of muscles. These are part of the, oh, I forgot. I wanted to talk about stability of vertebral fractures. Man, I'm going to lose my mind one of these days. Okay, so let's go back to here. So when you have a vertebral fracture, it can disrupt several of the ligaments that are involved in this stability of the spinal column. So actually, let's go to this one here. So we've got the posterior longitudinal ligament there. We've got the anterior longitudinal ligament there. We've got all these ligaments here on our vertebral arch. And depending on which of these ligaments might be disrupted in the case of vertebral fracture can determine the stability of the vertebral fracture. So if just, like say, you get some fracture and then tearing in ligaments here in this anterior column, it's going to be a fairly stable fracture. Same with just one of the columns here. So this is like the anterior column, basically, when we're talking about vertebral fractures. And then the middle, it would be in this area here, so the middle column. Anterior. And then this here would be the posterior column. Ay, ay, ay. See if I can write legibly. Okay. So in general, when talking about a vertebral fracture, if only one of these columns is disrupted, it's typically a fairly stable fracture. You immobilize the area of the spine, but you don't have to go in and fix the structures with, like, say, rods and screws, because there's enough other ligaments kind of holding things in the right locations. If two of these are compromised, then you've got a lot more likelihood for your vertebra to shift and start causing impingements of the vertebral canal or of the spinal nerve roots, and potentially causing a neurological event on top of that. And so very often that will be a case where they have to go in and fuse the vertebrae together to prevent sliding of those vertebrae. And then finally, if all three are disrupted, then you're in real bad shape. It's very likely that there's also some neurological damage and consequently some at least partial paralysis. So example of two being disrupted. So a friend of mine was hit when she was riding a bicycle and had cervical fractures in several of her vertebrae, and they ended up going in and fixing, I think, 3 of her vertebrae together to prevent it sliding forward and causing her to become a quadriplegic. So just a real world example. I don't have any x-rays, obviously, she didn't share that with me, but just a real world example of what they would be doing. Okay, so that's ligaments. Questions on fracture stability? Yeah, any questions? No? Okay. So let's talk about the musculature of the spine. So we've got the extrinsic muscles, and you guys remember from the intro yesterday, what were the extrinsic muscles?
Move the upper body.
Yep, they move the upper body. They're superficial, good, and they're innervated by the anterior rami of the spinal nerves, right? So that would be the trapezius and the latissimus dorsi. And so that's the most superficial level. So trapezius runs along the vertebral column and attaches to the spinous processes, also attaches to the base of the skull, and then those fibers then travel up to attach to the spine of the scapula, to the acromion, you can't see that there, and to the lateral part of the clavicle. And from that, what would you say the purpose, the action of the trapezius muscle is?
Oh, like
What's it do?
Raises the shoulder.
Does it keep your head upright?
What is it? It's attaching to the scapula here. So think scapula.
raises.
Yeah. So pulling the shoulder back. So
It's keeping you from tension.
yeah. So adduction, right? And also it can elevate or depress depending on which of the fibers are active. So the superior fibers can elevate the scapula. The inferior fibers can depress the scapula. And then working together, they all adduct the scapula, okay? Latissimus dorsi runs from the spinous processes of the lower vertebrae in the vertebral column, and then wraps around and articulates or inserts on the head of the the top of the humerus anteriorly. So it kind of wraps in around. And what would you think that would be?
Rotation.
Medial rotation of the humerus.
Mm-hmm. Yeah, so we've got rotation of the humerus. We also have adduction and extension of the humerus, depending on what other muscle groups are involved too. So let's write that as humerus. Extension, medial rotation, and what was the other one said?
Adduction.
Adduction, thank you. Okay, and this is scapular, ay. Okay, we also have the rhomboid, dang, drive me crazy, rhomboid minor and rhomboid major, which also attach to the spinous processes, just one layer, sorry?
Should it be abduction?
Because you have abduction for trapezius in your notes.
Do I?
Yeah.
That should have been adduction. That was a typo on my
For
part.
trapezius or for latissimus dorsi?
Trapezius.
That should be abduction. Yeah. So that's a typo on my part. My apologies.
Wait, what?
So trapezius
Yeah,
becomes
trapezius is right.
adduction of the.
Yeah, trapezius is abduction, right? And then latissimus dorsi is
Yeah, I thought it was
adduction.
Is it that way?
I thought it was abduction.
Look it up in your books, quick. Obviously, we're having crisis.
No, I think it's right here.
I think it was
Okay.
right in your notes.
I think in the note, yeah.
Because when you were saying it, I wasn't sure what you were saying exactly, so I looked at the notes.
Oh, okay.
Trapezius
So,
is
my
in-
apologies. Abduction.
Abduction and then adduction for latissimus dorsi because it adduction.
I get those backwards all the
For
time.
the trapezius, yes.
Ab?
Ab, yeah.
So, abduction. Okay.
And then the latissimus dorsi is adduction.
All right. So, we got that straight now?
Yeah.
Thank you for correcting me. I appreciate that. All right, so rhomboid major and rhomboid minor. So they attach the spinous processes just deep to the trapezius. So just one layer down, and then they attach on the other side to the inside of the scapula. So the medial portion of the under part of the scapula, and that would be scapular.
Retraction.
Yeah, retraction or adduction, right? Okay, and then we have the two rhomboids, the rhomboid minor, rhomboid major. The rhomboid minor is on top. It's more of a cylindrical muscle, whereas the rhomboid minor is the one on top. Cylindrical rhomboid major is a flatter sheet and inferior to the rhomboid minor. Okay. So that is the superficial group. And they're just under the skin and the superficial fascia.
Did you say the rhomboid minor was inferior to the major?
No, I said the major is inferior to the minor. Yeah. At least that's what I was supposed to have said. Whether I actually said that or not, you never know. Okay. All right, so then let's go down a layer and hit our intermediate layer of extrinsic muscles. And this is also often called the respiratory group. Because it is used in respiration. So we have the serratus posterior superior and the serratus posterior inferior. And these would elevate or depress the ribs when they contract. So serratus posterior superior would elevate. Mm-hmm. And the serratus posterior inferior would depress the lower ribs. Yep. Whoop. And in my notes, I tell you guys which ribs they are. So this is 2 through 5, and I can never remember all these numbers. 9 through 12. Okay. So this is our intermediate respiratory group of extrinsic muscles. So then let's switch to a different view. So this is a cross-sectional view, and based on the shape of everything and the muscles that are present, what level would you think this is at? So I heard 2.
Oh, this is abdominal, abdominal region.
So it would be what part of the spine?
Oh, like lumbar.
Lumbar spine. Right. So we've got here, we've got latissimus dorsi here, you can see, wrapped around there. And so that'd be just the lower inferior margin of that. And let's just look at something really quickly. How did that end up there? That was not supposed to be there. Oh well, we'll come back to it. So then we'll go to the intrinsic muscles. extrinsic group, and they are, you could say true back muscles because they embryologically develop from back tissue. The extrinsic muscles develop from other embryological sources. And they are innervated by which branches of the spinal nerves?
Posterior.
Posterior rami, exactly. So there's a whole bunch of them in here. And so I listed them all in the notes and gave the general location for them. And so you definitely should know that. You don't have to know the exact insertion and origins of them. Just for me, that helps me remember where it is and how it works. And that's what I want you to know is where it is, what is it doing when it contracts, okay? So let's just take them in groups. So we have them divided into several different groups, and they are, first the spinotraversalis group, and that is these guys here, the splenius capitis and splenius cervicus. So if I can spell this right. Spinoversalis subgroup. And they, in general, attach to the spinous processes here. So the spinous capitis attaches to spinous processes here. Spinous cervicus actually over or underlaps, whichever you want to say, the spinous capitis and attaches to spinous processes in this area. My notes say which ones, whatever they are. You should know them. I don't feel the need to say what they are. And then the spinous cervicus comes up and attaches to the transverse processes, I believe. Yes, of the cervical vertebrae. So I'll do that one, C1 to C3. Wow, that's pretty sad writing. C3 attaches that, and then spinous capitis attaches to the base of the skull. And based on that structure, what would you say their function is? Okay, what did I say?
To extend neck.
Mm-hmm.
Or head.
So neck extension.
Maintain posture.
Mm-hmm. And so that's when they're working as a pair. Now these are paired muscles, so what if one is active? What's it going to do?
Rotate head.
Head rotation. Is that going to be ipsilaterally or contralaterally? Same side as the
Ipsi.
muscle? Mm-hmm. Ipsilaterally, because it's same side as the muscle is on, right?
Oh, yeah.
Yeah, okay, good. So, so that is the spinotraversalis group. Then this other picture here on this side is the several different groups. We've got the erector spinae group. And based just from the name, what is your guess that they're going to do?
Keep your posture.
Yep, maintain posture. So it's going to be extension of the vertebral column, right? And that is the iliocostalis group. So here we've got the iliocostalis lumbarum, the iliocostalis thoracis. Where's the other one? Iliocostalis cervicus here. And based on their names, you also know where it's located. So iliocostalis lumbarum is in the lumbar area. Iliocostalis is, so the last part of that costalis is indicative of interaction with the rib. So these go from the vertebral column out to the ribs, articulate on the ribs. And is just lateral, I believe, to the angles of the ribs. Or is it just me? Anyways, it's close to the angle of the rib. Okay, and remember that's that point where the rib starts curving about. Okay. So know that their location, be able to identify them, and know that they're going to be vertebral extensors. We also have the longissimus group, so we have the longissimus thoracis here, longissimus cervicus, and longissimus capitis. And that one, they're associated with the transverse processes of the vertebrae. So we go from the spinous process out to the transverse process. And we have a thoracic group, we have a cervical group in the neck, and we also have a capitis group. And the capitis actually comes up and attaches to the base of the skull. With the posterior margin of the mastoid process, right up here. Okay. And then the final group is the spinalis subgroup, and they associate with the spinous processes of both the origins of the muscles are on the spinous processes of the vertebrae, and the insertions are also on the spinous processes. So here you can see them kind of arching around these areas here. So this is an example of spinalis. We have again the thoracis, the capitis there, and we don't have a lumbar version, and also the spinous. That's not spinous. I can't read my own slides. Good grief. So the spinalis thoracis is the only one that's distinct. The rest of them kind of blend in with the ligamentum nuchae and the semispinalis capitis, which is not shown on this slide. Okay, so that is your erector spinae group, except for the semispinalis ones, which are not shown on here, but just check out your book for the figures that have that on. Apparently I missed that in my putting together of this. Oh, here's a semispinalis here, semispinalis thoracis right there, and capitis right there. Okay. Questions so far? It's just basically running over them, making sure you are aware of them. The information's in the notes. There's also those tables in your textbook. They're really good. They show the insertion and the origin, and often give the innervation and the action as well.
So you want us to know all the innervations for the muscles?
No, you don't have to know the innervations.
Okay.
Just know where it is and what it does when it actually is active. Okay?
And you said we don't have to know the insertion or origin, right?
You don't have to give me the exact insertion or origin. Just you can say it's kind of thoracic vertebra to or just so that it makes sense of where it is, and to be able to identify it on a diagram or a picture of a cadaver or something like that.
Oh.
Okay? Good. All right, so that gives us our spinae erector group, and then we have the transversal spinalis group, and that is this group here. So these words. Okay, and these are also erector muscles, so they help stabilize and keep the spine erect, and also work as segmental muscles, so they very often segmented between short sections of the vertebrae. So the semispinalis capitis and semispinalis thoracis are the exceptions to that for this case. They run along the longer portions of the, what's it called, vertebral column, and go from thoracic vertebrae here to cervical vertebrae, and then cervical vertebrae up to the skull here for this one. And just from the notes, know in general which region each one is from, okay? Then we get to the more segmented ones, which includes the rotata torus, where we've got the thoracic group, there. Did I show the other ones? They did not. Sad. Anyway, so here's an example of the rotator one. So it goes from the transverse process to the base of the spinous process, and then there's a long one that goes out to the rib area, and that is useful in you're both keeping the spine erect, but also rotating the spine when one side is active versus the other. So rotation is important. That. Let's see. The levatorus group is also a deep muscle group, also paired, short little muscles paired in here. From, make sure I get this straight here, from the rib to, here you can see it's from the rib here to the spinous process of the next vertebra up. So just very short ones, and again, stabilizing for the spine and allowing for rotation.
That's the levatorus.
Yes, levatorus there. And then finally the intertransversari, and here they are down here, and they're just short little segments in between the transverse processes of adjacent vertebrae.
How easy is it for you to switch colors?
I can switch colors. What color would you like next?
Just when you're doing different
Yeah.
groups,
Okay.
can you switch colors? Because there's sometimes I'm trying to copy something and
Mhm.
then I go in and I'm like, I have no clue where you even wrote or did anything, so I'm searching, trying to figure that out. I'm like,
Right. Okay, so here, let's
That'd
do
be
for the
helpful.
intertransversari, purple, there we go. We can change this one here to red, they're gonna be right along there, does that help a little bit?
Yes.
Okay, cool.
Thank you.
Are there any others that are not terribly clear on this? Okay, most of this is just getting into your textbook and really just learning this stuff. And the more challenging aspect of it is taking it from the just learning where they are to what would it look like, you know, in an imaging scan when you're looking at it in cross section. So I have a little exercise later to help us out with that in a very basic way. Okay, so those are the segmented or segmental back muscles. So these ones there. Okay, any questions on this? Nope, okay. So in the cervical area, we have another set of muscles. So the rectus capitis posterior minor, which is here, runs from the base of the skull to the posterior arch of the C1 vertebra. Just make sure I'm saying this right, because I was learning them this morning. Okay, and then we have the rectus capitis posterior major, which runs from, again, the base of the skull down to the spinous process of C2 vertebra. And from those connection points, what would you say the action for that is? Yep, head extension. Okay. Then we also have the oblique capitis superior here, from the base of the head down to the transverse process of the C1 vertebra, and the obliquus capitis inferior from the transversus process of C1 to the spinous process of C2. So here we go. And let's do some color changing. So obliquus from here to here. And those two are important in, what would you say?
Rotation.
Rotation of the head. Now, this is it's a nice diagram, but I like to see it in all angles, which makes much more sense to me. So here we have a diagram similar to what we had. So we have the obliquus capitis inferior, rectus capitis posterior major, the obliquus capitis superior. Let's not destroy the text. And the rectus capitis posterior minor. And then we turn the head 90 degrees, and you can see a little bit better why, say, the obliquus capitis superior and inferior are involved in rotation of the head because of the way the muscles are oriented anterior posteriorly. So we can see here wrapping down around the base of the skull. So again, the tension in that muscle is going to pull the head around to that side. The same with the obliquus capitis inferior. It's going to pull the head around to that side a little bit. And then where the rectus capitis posterior major and minor are more located just right along the posterior aspect of the vertebral column, and is more important for extension of the muscles. Okay, any questions with those? All clear? Clear as mud? Okay. So, upshot of it is know morphology, location, and action of all the muscles. Like I said, you don't have to worry about exact origin insertion points, just in general. Is it on the thoracic vertebrae or is it on the cervical vertebrae, et cetera, okay? And in these figures and tables, okay? And it's basically what we just went through with just a couple extra figures for clarity added in. All right, so it's a short section, so what I wanted to do is just have some time for us to get used to identifying them without the lovely labels there. So let's start off with this one. This is which muscles in general, muscle group?
Superficial.
The superficial
Extrinsic.
layer of the extrinsic muscles. There we go. And so number one, what would that one be?
Trapezius.
Trapezius, good. Number two,
Rhomboid major.
rhomboid major. Number three,
Minor.
Rhomboid minor.
and number four,
Levator scapular.
levator scapula. And we didn't talk about that one. I forgot that one, didn't I? What does that do? Levator scapulae? It raises scapula. Name is very self-explanatory. It's great. I love that. Good. Okay, so here's another group. So number one would be which group of muscles? Sorry? Absolutely. Do you want to go back to that previous slide? Here.
What's the full name of them? Superficial muscles of the back?
Yeah, you can call them superficial muscles of the back. They're also the extrinsic muscles of the back, the superficial layer of the extrinsic muscles of the back. Yeah, any one of those would work. Okay, are we ready to move on? Or do we need some more time with this slide? Okay. No problem. All right. So then these are which major group of muscles? Yeah, they're the deep layer,
Intrinsic.
intrinsic muscles. Good. So number one, what would that group be?
Spinalis.
Which ones? I've got it in my head. Look back in the notes. Which one is it? I can't hear you. Yeah. Hmm? So just the major subgroup of them.
Spinalis.
Spinalis, right? Okay, because that is the most medial group of them. They're the ones that go just kind of between adjacent or between 2 or 3 vertebrae in a row. Okay, change colors. Number 2, which group would that be?
Longissimus.
Longissimus. And then number 3,
Iliocostalis.
mm-hmm. Iliocostalis. You're seeing how they're branching out from the vertebral column to articulate with the ribs, or attached to the ribs rather. Good. All right. So then, just take this back to cross-sectional view. So again, we've got our lumbar vertebra there. You can see the erector spinae group, subgroup muscles are here, surrounded by, this is a bad color for that. Change to red. There we go. Surrounded by the thoracolumbar fascia. And the fascia, like we talked about briefly in our lectures last week, it's one of its major functions is kind of to separate things and help with organization. So this whole group here of the erector spinae muscles are surrounded by this thoracolumbar fascia. Kind of makes it a group in and of itself. Helps with movement of those muscles, but the muscle groups past each other, and also particular nerve branches will come in and innervate this particular muscle group. Okay. There's several different layers of the thoracolumbar fascia, but just know that it's surrounding the major compartments of muscles in the deep back. All right, so here's another cross-sectional view, and what level would you say this one's at, based on what you see here? The shape of the vertebra? Thoracic, yep. Good. Thoracic.
I know.
Yeah, that's a dead giveaway right there. Okay, so again, just noticing the arrangement from a cross-sectional view. So we've got the erector spinae and the deep spinal muscles in this area here. Got superficial to that, we've got this next layer of muscles here, including the trapezius and potentially rhomboid there, I believe. Is that what they say it is?
It's not labeled.
It's not labeled. Oh, okay, whatever. So you can see the layers and layers of muscles. And so to just get a little practice, let's take a time, buddy up with somebody and see if you can identify numbers 9 through 19 and identify what vertebral level approximately, what vertebral region this would be in. So take a few minutes to do that.
No, lumbar. Pelvis lumbar. 9 is the supraspinatus.
That's gonna be out.
Yeah, we're in the.
This is spinalis, isn't it?
No, but it's more superficial than that. I think like 11 would be.
No, I think 11 would be like the ones where which are those ones, yeah. Oh, I think so. I think these are the
These are the.
yeah, like spinalis, longissimus, iliocosta. I think the
And then this.
yeah,
This
11.
would be the, whatever that's.
Spinalis longissimus.
Transversus spinalis.
Yes, and then
So it would be from inner to outer, so 9 would be spinalis.
would be deeper.
10 would be longissimus. Oh, maybe that's one above it. Yeah, I'm sure 9 is spinalis. Oh, that one.
That's the right side.
The right side, so spinalis for 9. And then 10 longissimus.
I don't know.
What's 15 and 18?
Those are
They go up and down the body.
the 12 new drawings.
A suited 11 might be.
19, I think it's quadratum lumborum.
Yeah.
Well, we know that 11 and 12
This would be the transversal transversal
Hey, this is 19, 19. I don't want to learn the moral type. What did they find for 11 and 12?
their erector spine is.
Okay.
But,
We don't know which one.
there's like 4.
I think either 11 or 12.
Well, it could be 14.
Well, I mean, we're in the lumbar region, so.
I would say that
Probably.
What about this one then? Multifidus?
No.
Because like, does that one go all the way down?
No, they, I think they said that they can get the directors.
That's what we thought these were though.
No.
so 11.
This is the one that we.
The spine is crossed.
No.
Yeah, those
I
are.
would say
Which one did you? What did you say it was named?
the iliocostalis.
Iliocostalis lumborum.
Yeah. Because we thought that one was here though.
No.
12.
Yeah, so that's okay. That's
Spine
the
out.
spinous ligament.
Unless it's
I mean, it could be these three.
Yeah, I don't know.
Yeah. Go back to
I don't know
page
about you, but it's still 20.
right here.
So, learning is done.
No more learning. Refuse to learn.
And then the spinous process are the
What's your name? Dr. what?
Burden.
Birding.
Or something like that.
Dr. B.
and
Yes, class is over.
and then the subject is over to broken out.
I think so.
Oh yeah, look at that. Okay, so.
Are we going to go over them? Do you have time?
I have time. If you guys have time, want to keep going over
I'd like to
a
go.
little bit?
Sure, go over quick. Just
Real quick.
Or you can
Real
leave if
quick.
you don't want to.
And then
Or do you guys want a little more time to think about it? Or
no.
Okay.
Thinking is overrated.
No more thinking? Okay. There you go.
This is spinalis and this is.
Yeah, we were right.
Yeah, we were right on those. 11 and 12 is multifundus.
Oh, what the heck is that?
And
Oh,
12
that's
is.
what I thought it was.
What?
That's what I said. I thought it was this muscle. See, I told you.
Good job.
I am
This will
correct.
be posted with the
Oh, it's
verbal
gonna
bond.
And 12 is rotatory.
Wait, no, what's that laughing? What I just said.
Mo-
What's 12?
Rotatories. Rotatories. Rees. The Costalis. 14th is, 15th. Transform.
So when you are done looking at this, you are free to go because class is over.
16, okay.
Take your time. It's fine. I'm here all day.
18. That's right.